Oh, hello everybody. I'm Chase, and my topic's on public health. And before we start, I'm just going to give you a quick overview of how my speech is going to roll. First, I'm going to tell you what public health is and what it's about, and then I'm going to do a brief look into just a few of the careers. I'm going to highlight actually 3 of them and just give you like a short list of careers that there is. So, with that said, public health is the science of protecting and improving the health of people in their communities, according to the CDC Foundation. Which that means is pretty much everything that you see, like your kids' nutrition, or their health, or whatever. I don't know if any of you have kids. You don't look like you would. Pretty young, but it's really everything to that, and preventing people from getting sick or injured in the first place. So, like seatbelts, wearing seatbelts, and stuff like that. They're behind those types of studies of improving one's well-being and health. And yeah, so what are some public health occupations? Epidemiologists, community health workers, health educators, healthcare social workers, mental health and substance abuse social workers, medical and health service managers, and natural sciences manager, health specialties teacher. And the first one I'm going to go into is epidemiologists. I'm not going to continue to say that word, so I'm going to shorten it to EAP. So whenever you just hear me say EAP, that's what I'm talking about. All right, what they do is they collect and analyze data to find the causes of diseases and other health problems, and plan and direct studies to treat public health problems. Certain types of it is infection control, pharmaceutical, field, and investigator. Pharmaceutical, or I'm sorry, I'll start with field. Field is typically they're dispatched to an area, like a community, if there's like an outbreak of a disease or something like that. They're going to try to identify what that disease or what's going on and stem the spread of it. And then pharmaceutical, those are the ones that test like chemicals on tissue samples. So if you ever wonder why like bleach burns the skin or whatever, any type of a certain chemical burns the skin, that they're mainly behind that. Which I always thought, I don't know why, but it was like some people like were in like locked up or something, and then like they got tested on from that stuff. So I don't know why I thought that. But and then infection control obviously would pretty self-explanatory. How do they study and analyze that disease or that infection to pretty much battle it, I guess it would be the proper word. And then for epidemiologists, or EAPs, sorry, master's degree in EAP for certain positions, and most require a bachelor's degree in a relevant field, and then you go on to the program that they have. It's Master of Public Health, which I thought it would be master's, but it just keeps saying it like that. So yeah, that takes 2 years. The salary range is actually pretty good. It's $78,000 to $109,000, and they have a projected growth rate of 9% from 2016 to 2026. They're very detail-oriented people, organized and great communication skills, socially aware and analytical, of course. And their workplace can vary, like I said, from hospitals, labs, or to your neighborhood or community. All right, another one is healthcare social workers, and they provide people and families with psychosocial support, help them cope with chronic and acute terminal illnesses. They also educate and counsel patients. They also case managers and intervention to promote health, which means like, so if like a kid, I guess, would be not living in suitable conditions and that's causing their health to deteriorate, they would step in and manage that case and give advice and treatment plans to the parents or completely take away from them. Healthcare social worker, most healthcare social worker positions require a master's, although some with a bachelor's, but it limits your scope. So pretty much you don't even do it, you might as well go for the master's. And then master level social workers are licensed in all U.S. jurisdiction once they complete the process, which is they get certified social worker in healthcare credential, which takes 2 to 3 years, and it's only recommended after you work under that 2 to 3 years under a supervisor. And they must have the ability for deductive reasoning, obviously, if they're analyzing families and trying to help them out with their care plan. And active listening, excellent communication skills, and social perceptiveness. And their salary ranges is from $53,000 to $64,000, and their projected growth is 19% from 2016 to 27. That was supposed to be 26, but sorry, my bad. Work everywhere, but mainly schools, mental health facilities, child welfare, and human service agencies. And then health educators, teaching people about behaviors that lead to better wellness while also creating and implementing plans to improve people's health. Education typically requires a bachelor's degree in health education, obviously, or health promotion is required. Some position requires certified health education specialist credential, and their salary is $30,000 to $60,000. And they generally work full time in a variety of places, including hospitals, non-profit organizations, or government and doctor's offices. Their growth rate is expected 12% from 2014 to 2024. And they have to have, some of their traits are communicate effectively, active listening, public speaking, obviously, reading, writing, patience is a good one, and that's it. There's my citations. Any questions?
Participation. Great, thank you.